presentation at ASH this year that I'll be doing is related to the use of epcoritamab for patients with diffuse large B-cell lymphoma and trying to look at a optimization cohort. And in this optimization cohort, the patients received steroid pre-administration before the first several doses. In addition, they received step-up dosing. So the first 2 doses were smaller. The third dose was the first full dose. The patients were able to have a decreased cytokine release syndrome with this approach. They also had a decreased IL-6 level that was documented using this approach, which also correlates with decreased cytokine release syndrome. And the patients had minimal neurologic toxicity. So using this step-up dosing, pre-administration of steroids, and checking for signs and symptoms of neurotoxicity and cytokine release syndrome, it was felt that the outcome for patients when compared to prior studies was pretty similar. And therefore, the step-up dosing is now what's going to be recommended for patients in trying to treat them for diffuse large B-cell lymphoma with epcoritamab. The administration is all outpatient, with the possible exception of the full dose, which is the third dose. Patients can have a optional admission to the hospital as the cytokine release syndrome, if it was going to happen, happened typically within 24 to 48 hours after that first dose. So I think this is a very important outcome for this patient population, especially if we can do this with outpatient therapy and fairly comfortable with minimal toxicity. I see that this is a big improvement for patients using this bispecific antibody. Future studies with epcoritamab is mostly in combination therapy, looking at not only monotherapy with this agent, but trying to combine it with other chemotherapies or potentially other biologic agents, other pathway-directed therapies, to see if they can increase the response rate even over what was seen with monotherapy, while not increasing the side effects or toxicity. So I think over the next few years, we'll be seeing a lot of combination therapies, particularly probably earlier in the course of the disease for patients with different subtypes of lymphoma.